Hello everybody, my name is Josh Jacob. Welcome once again to our webcast on behalf of Surrey Total Health. As I said, I'm a consultant orthopedic surgeon specialized in hip and knee arthroplasties, if you've seen some of our previous webcasts, and it's my pleasure to invite Mr. Mohamed Imam, a good friend and colleague of mine, as well as Dave Emsley, who's also a physiotherapist. Mohamed Imam is a consultant orthopedic surgeon, and he specializes in upper limb surgery, that is the shoulder, elbows, and wrists. He's done fellowships all over the world, very prestigious universities in the Western Hemisphere, both here in England and abroad. He specializes in shoulder and upper limb trauma surgery, as well as elective surgery. He's done his fellowships in Oxford, in the Royal National Hospital in Birmingham. He's also been overseas to Zurich, and of course, last but not least, to America at the Mayo Clinic and the Stedman clinics. He's also an expert in, as a FIFA medical officer in many of the sporting events. And last but not least, he's published very seminal papers, and you're very welcome to Google them up and see his name attached to many of the peer-leading papers. We also have Dave Emsley, who's a physiotherapist, who's got experience both in physiotherapy and also his background in sports science. Dave is at the Physio Body Mechanics as a director, and it's my pleasure to welcome you both. On today's webcast, we are trying to extract information from both our surgeon and the physiotherapist on the effects of the coronavirus on joints. Now, Mr. Imam, as you know, the virus has had an affectation on the respiratory system, cardiovascular system, the renal system. There's also been evidence that people have had strokes as a result of the hypercoagulability of blood caused by the virus. But what, in your experience, could be the direct insult on joints, especially those who are in the lockdown period?
That's a very good question, Josh. Thank you. It is a question that patients are asking their surgeons frequently in the midst of this pandemic. Many of the symptoms of the coronavirus mimic the typical symptoms of a viral infection or flu syndrome. One of these symptoms would be the muscle aches or myalgia. You may get pain in your arms, legs, or backs that develop spontaneously with no injury. Typically, in a coronavirus infection, the pain is in the muscles, not in the joints. But if you have an arthritic joint, of course, in your arm or leg or back, the virus may increase the symptoms, and the pain might be even severe or limiting. While, as you've mentioned, the virus has permanent damage to vital organs like lungs, kidneys, or butt, or other vital organs, it isn't known to cause any permanent damage to bones and joints. It is, however, too early in the pandemic to know all of the long-term consequences affecting the musculoskeletal system. And I've reviewed few recent research, none has been proven as yet. Another important point that I wanted to highlight as well is that many of our patients are taking anti-inflammatory medication to help control the pain and sometimes the fever brought on by the virus. However, or they may take anti-inflammatory medication because they have ongoing symptoms from an arthritic joint. While these medications may be helpful in managing pain symptoms, it can also reduce the fever and make the patient as afebrile, which would help to diagnose the infection of COVID-19. For this reason, you should consult your GP if you are experiencing any viral-like symptoms before continuing your anti-inflammatory medication. Another direct effect here would be in other upper limb problems like inflammatory processes like impingement, bursitis, tendinitis, or even those with gout. These symptoms can mimic musculoskeletal pain, and muscle aches are side effects of some of these medications. So whenever you're in doubt, just contact your GP. In regards to, there are indirect effects of the COVID-19 infection, and I would think David would tell us more about that, as he has a lot of experience in this regard.
Thanks very much. Indeed, a great explanation of the direct effects of the virus. There are indirect effects, of course. As the body is attacked by the virus, you have a decrease in energy, you have a fatigue, and you have to let the body recover before you get back into doing any strenuous exercise. We have seen clients who have been affected by the virus, and actually the aches and pains are not a direct result of the virus. They're coming to see us because they've started exercise in recovery from the virus and not giving themselves enough time to recover. The other indirect factor, of course, is that we're living in a different way now. We're in lockdown, where we've changed our way of life. So we are homeschooling, we are working from home, we're using makeshift desk setup. We're doing our best to keep everything going, ready for the end of lockdown, which hopefully will come sooner rather than later. But this different position that we're working in puts us into altered postures that we're not used to. It actually asks the muscles to work in a different way. And you can create back pain from this, neck pain, shoulder aches, because if the body's not used to being in that position, you're asking it to be in that position day after day after day, it's going to get unhappy. To this end, reviewing your desk setup and how you are working at home is certainly advised, and making sure you set a timer for it for about 30 minutes, 45 minutes if you really are pushing things, that every time the timer goes off, get up and move around, okay? Shrug the shoulders, roll the shoulders, move the arms up, move them back down again, march on the spot, go for a little walk around the house, grab a glass of water, come back in and start work again. Having that little break just resets the system. It allows your postural system to activate, gets your cardiovascular system working, and just allows you to breathe, for want of a better phrase. We did talk about exercise in a previous webcast, but certainly if we are in this position that we're in lockdown, and we are working from home and there's high stress, there's children being schooled, we are holding tension into the body, we're working in compromised positions. If we then say, right, we've got a chance to exercise, we set our watch, boom, off we go, and we go straight out into exercising, we are seeing a high prevalence of people contacting us saying, I've hurt my back, I've hurt my leg, because they're running or exercising from a position where they've spent all day in one tucked up position, and suddenly they're asking a question of the body. They're asking it to exercise at a high intensity. Make sure you're moving around every day. Make sure that you're warming up before you do any exercise, that you're warming down after any exercise, because by holding sustained postures, you're putting pressures onto the back that it's not going to be happy about. And certainly do review how you're working at home, because a lot of us are now. It's alien to us. It's alien to me as a physiotherapist for certain. So checking how you are working, checking what position you're in, making sure it's correct, moving regularly. Best way to protect yourself from the indirect effects of where we are as regards COVID-19.
Oh, wow, that's very succinctly put, Dave. You just reminded me to adjust the height of my computer and my chair so that I also don't get the cramps that you've been explaining. Just one more question, Mr. Imam. I have patients who've asked me during my teleconsultation, how about giving them a steroid injection to tide over the symptoms until they get their final hip or knee replacement? Obviously, I've deferred that because that has deleterious effects. Now, in addition to having steroid injections injected into the upper limb joints, also just as an ancillary question, what about the benefits, if there are any, to taking supplements over the counter like, cod liver oil tablets, glucosamine chondroitin sulfate, turmeric tablets? Is this something valid, or should they be a little more introspective if they have to buy them?
Thank you, Mr. Jacobs. These are very important questions. Within our practice, there are a number of important considerations for patient safety and operational pressures, which during this pandemic, and this require a temporary change of practice. The problem, corticosteroids are, the problem with steroid injections, actually, they are known to cause a transient reduction in immunity and suppress the hypothalamic pituitary adrenal axis, which in lay terms, it suppresses the pathway in our body for our immunity to be stimulated in order to fight any foreign virus. And actually, there was a small study of patients in China, and they found that steroids can increase symptoms of the disease and some biomechanical and radiological severity markers in young patients. And subsequently, as a result, there are now certain guidelines, national guidelines that is advising against intra-articular injections of steroids in general. However, there is still as yet no solid evidence, but because of the concerns and because injections might not be life-saving in medications, we currently defer from undertaking our regular practice as surgeons, as therapists, as radiologists of injecting steroids routinely in the current milieu. In regards to also another point to consider, that there is the effect of injections is very variable, because the absorption of these steroids into the bloodstream to enter the systemic circulation is proportional to the medication, to the injection, to where it was injected. But general consensus is to avoid them. However, these treatments should be bespoke to different patients, and you have to have this discussion with your physician or therapist before proceeding. In regards to the second question, which is a very important question, all the evidence that I'm aware of, no strong solid evidence support the use of these supplements like glucosamine and so. Because there is some evidence supporting that they are good in pain management, but whether or not they would stop the progression of arthritis, no one has proved it in a properly conducted level 1 evidence. So if patients feel that their pain is controlled with these supplements, there is no major risks with these supplements. However, there is no evidence supporting a superior effect of having these supplements as a routine medication to prevent the progression of arthritis or inflammation.
Thank you, Mohamed, Imam, and David Emsley. Feel free to tune in again to our website, sorrytotalhealth.com, and we trust that you've enjoyed this webcast. Thank you.